Osteoarthritis is the leading cause of disability in developed countries. In the United States, affects 80% of the people over the age of 65. But what is osteoarthritis? Articular cartilage connects joints between bones, providing a smooth and lubricated surface for articulation, which translates in a healthy movement of the joints. Cartilage is also a vascular tissue with limited self-repair capacity. Therefore, when a defect appears due to injury or it wears away with age, bone rubs against bone, causing pain and limiting movement. How is osteoarthritis treated? Current available treatments for chondral defects include debridement of the damaged tissue, microfracture of the cartilage to head self-repairing, or mosaic-plasty by transferring one or more cylindrical cartilage autografts. However, while healing of the cartilage has been documented, it leads to an inferior tissue, fibrocartilage, which has poor wear characteristics and deteriorates over the time, resulting in a return of the original symptoms. In recent years, tissue engineering has been explored as a potentially viable alternative, for example through the implantation of scaffolds. These are prefabricated biomaterial constructs that fill in the defect and bring support to the native cells to grow, encouraging articular cartilage formation. The scaffold eventually degrades, leaving only the new tissue. But how scaffolds can be created to treat osteoarthritis? Through imaging techniques, a picture of the defect is taken and translated into a 3D porous construct in the computer. Then is 3D printed into a biodegradable polymer and placed in the defect through an open surgery. After a period of time, the scaffold disappears, leaving a healthy cartilage. But what if there is a way of skipping all of these steps? Hi, my name is Elena Sedano. I'm a student of the MSc in Bioengineering at Trinity College, and I'm working with Professor Buckley to analyze the feasibility of intraoperative 3D printing of scaffolds for tissue repair. The idea of the project is to shorten the process of creating scaffolds with the 3D printing method by directly building them intraoperatively using a 3D pen. The preliminary results of the project show that with very similar mechanical properties of the specimens created by the two methods, the times for printing decreased significantly using the 3D pen, even without including the steps of taking the images of the defect and create a scaffold in the computer. But in order to make possible to create viable scaffolds, the accuracy of the geometry of the porous structures created by the 3D pen needs to be measured and improved. Besides the decrease in time, the 3D pen allows to create scaffolds intraoperatively. Arthroscopy is a surgical technique in which tube-like instruments are inserted into a joint to inspect, diagnose, and repair tissues. During the procedure, the surgeon inserts the arthroscope and a small camera, the irrigating device and the trimming instrument that will be replaced by the 3D pen. Therefore, the design of the pen needs to be changed to use it both accurately and intraoperatively. Porosity and interconnectivity of the scaffold will influence the cell migration and the diffusion of oxygen and nutrients, consequently the final feasibility of the reconstruction of the defect. Together with the mechanical properties of the scaffold, they will be measured and compared to the traditional way of 3D printing. So summing up, using the 3D pen, scaffolds as a solution for cartilage defects becomes quicker and less invasive, and therefore a more feasible procedure.